Good afternoon, everyone. Thank you for joining us again. And nice to see you if it's the first time you're joining today. As always, we'll just give it a couple more minutes for other attendees to join too before we get started. Let me have a look. Have we got any familiar faces and names? Hi, Tom. Hi, Ellen. Glad you could make it.
Hello.
Raphael, Erin. Nice to see you all. Matthew Collis again. Thank you. Don't worry, I won't ask you all to sing songs or any initiations or anything. Don't worry. Not today. Give it another minute or so. Unfortunately, if you did make it to the last one, we were just discussing this. You will have seen a poem in the chat as we were in this stage of the webinar, waiting for everyone to join it. And unfortunately, yeah, I don't have a poem for you all this week. I will make up for you. I will make it up for you next time though, somehow. Someone's commented saying that the meeting audio is echoing. Is that just myself? Do we know? I don't know if Sherry, if you could test your mic and just see if you're also echoing. If Karen, if you were able to feed that back.
You sound good to me, Oliver.
As do you to me. Okay, so people can hear an echo. Okay.
Yeah, seems okay to me as well.
Okay.
Karen is a troublemaker, so I'm not surprised.
Okay, we've muted everyone just in case. In the meantime, as we go through the webinar, I will go on mute as well, so there should only be one microphone open at a time. But please do let us know in the chat if that continues to be an issue, and we'll work as hard as we can, as quickly as we can in the background to resolve any of that as well. And as I've said that, my phone Google has been listening to it and pinged. Right, let's get started though. So yeah, thank you everyone again for joining on the third and final part of our 3-part webinar series here with Cincinnati Children's Hospital, talking around quality excellence. More specifically, if you've been with us as part of the first 2 episodes, we've been talking about control charts, how control charts have been used in Cincinnati, starting from 20 years ago or so up until now. And what Sherry and Marianne will be talking about primarily in today's session is the transformation from where they've been to where they're looking to go, not only in the present on the projects they're working on internally in themselves now, but also going forward as well in terms of what the future may look like or what they'd like it to look like going forward as well. So hopefully it'll be another really interesting session for you all. So yeah, without me babbling on any longer, I'll hand over to Sherry and Marianne and the team. Oh, in fact, just before I do that, I will do a quick apologies for Blair. So Blair has been lucky enough to be on a plane on her way to Hawaii at the moment, so wasn't able to join us for this call. But again, if you've been with us the first 2 episodes, you'll know that Blair has more than played her part in this series through her presentations previously. But yeah, over to you, Marianne and Sherry.
Yeah. Thanks, Oliver. Yeah, nobody feel bad for Blair, but we are glad she was able to join us for the first 2 parts of the series. So happy to be with you all again today for the 3rd and final installment of this webinar series. I'm Marianne Link, and today we're going to explore a little bit more about how at Cincinnati Children's we're planning to sustain excellence and quality improvement through the Power Platform and EasySPC applications. We're going to delve into our strategies for data collection, analysis, and reporting. And we'll talk a little bit about how quality excellence reports are going to empower our hospital staff and leaders, and how we'll hear about our valuable lessons learned so far, some struggles that we continue to deal with. So we'll share those transparently, and then some best practices that we're learning and sharing. Yeah, and then you'll hear from Sherry some of our plans for expansion in the next year and years to come. Yeah, so we'll get into it. So a little bit of just a recap. We've talked a little bit about how we define quality excellence at Cincinnati Children's and how we are really working to develop, support, and manage that system of world-class quality. And as you know, Blair and Sherry and I are leaders in the infrastructure area of these quality domains. So we manage the teams of quality improvement professionals, data scientists, and project management staff that support hospital quality improvement work. So as we talked about the last two parts of the series, we feel really confident that we've done well at developing world-class quality through our quality capability courses. We all speak QI. It is part of our culture at Cincinnati Children's. It has allowed us to really accelerate improvement since we use improvement science as a framework. And we have a great support network for supporting this world-class quality. We've got lots of quality improvement evidence data specialists that support our hospital leaders. So that allows them to do this great work and make it move faster. We are not ready to check the last box yet, but we want to share with you today how we're thinking about managing better toward world-class quality. So as Sherry mentioned last week, we've outgrown our old structure, and unfortunately, we found that we've got these pockets of excellence throughout the medical center, but we're quite siloed, and we have difficulty spreading good innovation across our entire system, and we've noticed variation in adherence to our data standards and methods. So that is definitely something we want to get back up to par. And we absolutely think that these new applications are going to assist us in doing that. So how are we going to check that box, managing world-class quality? We have some ideas that we're working on this year very intentionally. So providing that system visibility to all of children's quality improvement portfolio of work. Sherry's going to talk about the system that we're existing today, some opportunities that we have to improve and change it, and this is what we're embarking on this fiscal year. And spreading proven innovation across the system. As I mentioned, we haven't made it easy on ourselves when we do have a great successful improvement initiative to spread it to other like areas. It's generally the burden on the other area to take it on. So we haven't made it easy for folks to do knowledge sharing, to learn, and to adopt new innovation and change. So we're hoping that these new digital platforms are going to help us with that effort. And then absolutely leveraging our talent at the top of their licensure. So within our infrastructure, even within our quality infrastructure, we've got different layers and levels of improvement folks and data folks and project management staff. And unfortunately, we have a lot of our very talented quality improvement professionals doing some data entry, redundant reporting, and really not value-added tasks related to getting information to the leaders who are making decisions. And this is a pain point for our staff, and it's also not the best use of their time. So we're absolutely focused on removing that pebble in their shoe so that they can use their full talents on doing actual improvement and data analytic work. And as I mentioned before, and Sherry said last week, we've got to go back to adhering to our data and visualization standards across everywhere we do data work and we're doing improvement science work. So we have to have fidelity to our methods. So that is definitely on our minds. We're going to get back to those standards.
Yeah, and I want to add that the item preceding this, the leveraging our talent to the top of the licensure, is also the right, like making sure the right people are managing the data and really organizing the data and holding ourselves accountable to those visualization standards and those charting standards. We don't always have the right people doing the right job. So, and we're really experiencing that and living that right now as a result.
Yeah, absolutely. Thanks, Sherry.
So how are we going to do all of those things? So we this is an age-old problem that we've really had at Children's, and we do a great job, but we can do a better job. And now we have access to tools and enterprise licenses for sharing, and we've really come to a place where we can see a significant transformation in the work that we do and how we deliver the quality excellence across the organization. And ultimately, the Power Platform has lots and lots of tools within it. And what I'm going to do is show you the solution that we're building to using many pieces of this Power Platform. So we're going to be using Power BI, of course, with EasySPC as a visualization tool for those charts, Power Apps, with regards to management of the project portfolios, and Power Automate to send those notifications, and bringing that awareness to and really organizing us and holding us accountable to whatever processes we define using these tools, holding ourselves accountable to actually doing that, increasing that level of reliability. So, and then of course on the back end, not as forward facing, we'll be of course using the many data connectors that are compatible with Microsoft Power Platform and Power BI and Power Apps, and then also the Dataverse. So ultimately, I think it's you, Marianne. Yep. So before we get into all of that, we're going to talk a little bit about training that was required, because these are new tools. Power Platform is a relatively new tool for Cincinnati Children's as far as an enterprise solution and enterprise tools that we're trying to really leverage now. So we're going to talk a little bit about training and change management that was needed as a result of these being new for us.
Yeah, so absolutely. We want to sort of take our own medicine. So part of doing any kind of improvement work or managing a big change is using good change management strategies. And so this is actually a model that we teach in our classes, Cotter's 8-step change model, which is great for large scale change. And Sherry has really taken this to heart. And I think it's based on learning, maybe that many of us on this call have experienced, of failed implementations, right? Failed changes. And so what can we learn about that? Because this is a lot of psychology. We're asking our people to do their work differently, to learn new skills, and to leave something that they're used to behind. And so recognizing that change is hard, we want to take an intentional approach. So we are using Cotter to help guide us through this change. And while this is not a completely linear approach, we feel that, we are moving through and we're getting to probably, we think maybe step 5 of this wheel. So, and we'll describe a little bit about how we've been communicating and intentionally forming our teams and steering committee to support the change that's ahead, so everyone feels a part of it rather than resisting
it. Sorry, I had to do too many things at once there. Unmute, advance the slides. So the transformation, the digital transformation started, a couple of years ago. So the data and analytics team, we kind of had a little bit of a preview to the changes that were coming. So we started our training and scaling up our staff about a year ago, a little over a year ago. And we started with, one of the first things that we started with was our template. You may remember last week I talked about a template that was put together for Power BI, and it had EasySPC, our license, already part of that template. So we unleashed it to the organization and said, go ahead and go try it. So we call that kicking the tires here. So, and Blair's not here, but I do got to poke a little fun at her. So anything new, Blair says, we need to kick the tires on that. It's time to kick the tires. And I wanted to put a little bit of definition up here for you on that, because if I've learned nothing in the last year and a half collaboration with the Brits, is to never assume things that are commonplace for us are, commonplace for you. So when I first showed this to Oliver, he was like, what are you talking about? So in any case, we provided some guidance on the Power BI desktop install, as far as which one. We started out with the reporting server. Actually, we've grown so much. Our journey is really quite remarkable, even this past year. But we were on a reporting server initially, and so we had to do some. There's two different versions of desktop, but I won't get into that. I don't want to confuse all of you. But so we had to give some guidance on the desktop installations. We did that template demonstration as far as how to use it as a very high level, and then we just put it out on the server and shared file location. Said, go use it, have fun, go play, essentially, right? And that went well. It worked really well. We had some really phenomenal reports that came out of it, but there were still a lot of questions because it's so new. So we wanted to make sure that the staff felt really supported and they were getting the training that they needed. So we contracted with a company called Insight, and an instructor was brought in, and he delivered a 3-part course package. Those courses were called Dashboard in a Day, Power BI for dataset developers, Power BI for report creators. So we had some instructor-led courses that were offered to the staff to help kind of jumpstart their education around these tools. And then additionally, we have a learning platform resource. It's called Percipio, and it's phenomenal. There's an unbelievable amount of content that is in there, and it's just available to us as Anderson Center employees. So there's over 2,000 books, courses, and videos specifically on the subject of Power Platform. So it's a self-paced learning opportunity that folks can take advantage of. Right.
So
back.
Thanks, Sherry. So we took a breath to do a check-in with the staff, so with the users, sort of a pre-launch satisfaction survey. And that the purpose of this was really to better understand the current state of our portfolio management system in the areas of usability, support and resources, and leadership engagement. And we wanted to set a baseline to compare to the post-launch of the new application. So we'll plan on doing a post-launch survey, likely in the spring, right, Sherry? But what we saw and we predicted a score that was going to be less than awesome. And so on a 10-point scale, overall satisfaction was about a 4 on average. So as you can see, folks are not thrilled with our current portfolio management system. As I mentioned before, there's a lot of extra reporting. It's not that user-friendly. And time tracking is not awesome. A bunch of reasons why folks are not loving it. So what's good about this is it leaves us primed for an opportunity for improvement. But some areas, of course, that we want to, some more detail in that survey around things that had worked well were they did get adequate training on that new system. They had a known point of contact. Of course, we need to have like sort of that customer support, timely responses, expectations are communicated. Some gaps and opportunities, so areas that we really want to focus are on its usability, the management of the work, visibility into projects, and then folks were kind of neutral on access to job aids and videos. Sherry and her team are working on this for the new application. The ease of reviewing stuff they need to know, and information used by leadership. So that's on me, and it's also on the quality improvement domain leaders and our customers in the hospital. So if they love it, they will use it.
Yeah, that last bullet point is the it's a gap in my opinion as well, simply because if they don't know whether or not leadership is using it, you're going to lose a ton of credibility. Like there's not going to be, if they don't feel like that information that they're taking the time to manage in this system is actually being looked at by anybody, they're not going to put a lot of time and effort into making sure that it's correct and relevant. And so that last bullet point is definitely a focus for us. We want to make sure that all of our employees know that we are using this information and that leadership is looking at it and it is extremely valuable.
Absolutely. So the next one was really around a survey of the same folks around change readiness. And we were very encouraged that, and this is on a 5-point scale on all of these statements. You know, I think the change is necessary. I want to change the way we work. I think I can contribute to it. I can learn new skills. This will make my job easier. And the teams I support will benefit from this change. All high marks. So what's nice to know here is that we feel ready to move this change forward because it's going to be a win in so many different areas. So helps us feel good about moving forward. If any of these scores were low, we would need to shore that up before moving forward.
I was shocked by this, honestly, when we put this out, and because change is hard. People, especially for teams and people who are using processes and tools that have been in place for many, many years. So this really surprised me. And it made our next steps much easier ultimately.
Agreed. So now in terms of the formation of structure that will help with the change. And kudos to Sherry for being very thoughtful about putting this together. So we have a steering committee. Sherry, myself, and Blair, as well as our VP, are part of the steering committee. So we're setting the vision. We are demonstrating commitment, trying to provide clear expectations. We are open to receiving feedback and responding, and we want to help our leaders learn these new tools. And I'll say also, my folks who are part of the Change Coalition team, so those are our leaders who manage the staff. It's in their goals this year. So to help with this change, they're excited about it, but they need to have capacity to do this work in addition to their people management jobs and their other quality improvement support work. So it's important that I, as a leader, set that expectation for the Change Coalition teams so that they know this is important, and it is an expectation, and they're on board with helping their staff be successful in the change. And then we also have focus groups and functional teams established. So this is work that is coming and being described in our project charter. And I don't know if you want to go into that more, Sherry, but this is structurally how we're planning for the change.
The primary thing is to make sure that this group right here, they're driving the change. So change, where change fails, where ultimately things start to fall apart, it's not the technology. The technology doesn't fail us. It's really the people. We are our own worst enemy. So very rarely is it the technology that didn't provide what we needed it to provide. It's that we didn't take the time to really look at the tools, evaluate what impact will this have on my work? How do I best leverage these tools in an effective way to ultimately be successful? And what are the associated processes that I need to now implement to most effectively use these new tools? So it's never the tech that's the problem. It's the people. It's us. So the primary and the way to do that, if I were to come at any of these resource groups and say, all right, we're going to use this tool this way, and this is how you're now going to do your job, it would fall flat. So this is the strategy right here, the people driving the change and really identifying how best to use these tools and successfully provide the support that our teams need across the organization. That's all right here. All the change is happening right here. We're helping to provide the tools, but this group, the focus group, is, I suppose I need to put my mouse over here, but the focus group, that change right here, they are the ones that are driving the change. So what is the change, right? So ultimately, we're talking a lot about change, but what is it? Like, shut up and show me, right? Just like, what is it exactly that you're doing? And there's so much that we're doing. We're so excited about it. So let me show you. I'm going to just show you. I don't have a slide deck to show you with this particular quip list, but what we have initially, the first part of the conversation to really start to show people like the move that we were trying to go to and the direction that we were trying to move into. James and Reg and the team at BCN, they put together a proof of concept in collaboration with us and our requirements. And then we started showing that to our staff and to our leaders across the organization to get some feedback against, like, this is what we're thinking ultimately. And then they gave us some feedback, and then we landed on a final proof of concept that we started building to. So let me bring that over here into view so you guys can see this. And this is one component of the Power BI reports that it's like a package of reports that we're putting together and visuals that we're putting together. But one of the important ones that will be forward facing to our organization is the Quality Improvement Project List, or QUIP list. So the idea with this list really is to give a place, a single point of really, and it's not really entry because it's the output, but a single report that if I have a question about a quality improvement project I know is happening over in endocrinology, I know, oh, I need to go to the QUIP list. I mean, let me go to the QUIP list and look that up. And ultimately, the end user can come over to area of service. They can click on drop down. They can click on the, and they can find endocrinology and select that. And when that happens, these data that are displayed here will change dynamically. So according to whatever area of interest is important to the end user at the time of viewing, these things will change dynamically. So if I like maybe I'm a system leader and I want to know, well, where are all of the troubles in the organization, I can click on this little part of the pie chart here where it's red. These are the ones that are in trouble, and that list will filter down accordingly. So once I am satisfied with how I've filtered, and then, again, these are all of the quality improvement projects happening across the organization right now, giving us that system view that we never had previously. We never had a single place to go to see what is the work that we're doing and what impact is it having? Are we meeting our goals? How far along are we, et cetera? So it's giving us that system view we've never had previously. Once I have filtered my list down to my preference, I can then click over into the report, the project details page. And this is modeled off of one of our tools. It's called an A3 that we use in I2, S2. And some typical information, just overview information with regards to the project will follow its way throughout all of the different pages of the project details area. As far as the status, how are we doing, is the, and this is subjective, by the way, so the objective, so the project owner can work with the team, and there's lots of different things, not just the data, that's going to influence the project health. There, like, we may be rocking and rolling where the data is concerned, but there's a change that has occurred or something has happened that's influenced that project, and we know it's going to adversely impact it, but it's just down the line a little bit. Maybe we had a tremendous amount of staff turnover, and we know it's going to impact the project in a negative way. The project owner and the team can indicate we're not doing so well. So that is the health indicator there. We have our start and end dates. Just the typical information that you would want to know in summary about a project. And then we have our tests of change. Like, what are the things that we're working on to try and reach our goals? What are those interventions that we're testing? Which ones worked? Which ones didn't work? A summary of what we've done in the last 30 days as far as testing interventions. What are some interventions that we have coming up, right? And so the KDD, that's a really important tool that we want to incorporate into this project summaries page. Challenges and escalations that we may be having. highlights and milestones, just giving that overview of the project and what we're trying to accomplish and how we're doing overall. DEI considerations is something that we're really working hard on at Cincinnati Children's. We've been doing, I mean, we're well into our DEI journey and really making that commonplace culturally. As far as when we're working on a project, we want to make sure ultimately we're always thinking about what are potential healthcare disparities within the population that we're trying to improve, and trying to identify, thinking about, is this, like, as a whole, we might be doing really well, but are there any healthcare disparities potentially that we should be looking into and have our considerations for? So that's what DEI considerations is about. This is the part that I get really excited about. So the charts, right? So where's the data? So if you click on the charts tab up at the top here, you'll see we have all of the associated measures that we've identified as important. It's a measure portfolio that is important to gauging whether or not we're being successful with this project. And it will have various charts or various measures that will be, so our outcome measure, process measure, balancing measures, those will be identified and distinguished within the application that we're building. But ultimately, we can assign what are the measures that we're looking at to gauge whether or not we're being successful. Down here in the scorecard view is a list of those metrics and some key information as far as what's our desired direction, what type of domains, what type of measure it is. As far as is it a safety measure? Is it a PFE measure, patient and family experience measure? So baseline, goal, typical things that you would like to see in summary as far as that metric goes, and of course the data. The color coding in here is intended to be automatic. So based upon what we've passed in as our baseline and what our goal is, and using some trend-based color coding, we'll have these indicators happen automatically. All right, so some of you who are further along in your quality improvement journey, and it's really part of your culture, you're looking at this and you're thinking, that's not an SPC chart. Like, what am I looking at here? So this item, this link right here, that will actually, I'm going to go into this a little bit more detail soon, but ultimately it will open up the associated SPC chart by clicking on this link. All right, so I don't know if I'm going to share anything else with this one. I think that is it with regards to the proof of concept. So moving on to, we showed this ultimately to lots of different people, and people got really excited. But one of the first questions that everyone asked was, this is fantastic, but how the heck is all of the data and the information? That's a lot of stuff. How is it going to possibly get in there? People were, of course, naturally thinking it's going to be a manual maintenance of, I got to update all of these different pages within this Power BI report. And there was a lot of questions around how is all of the data going to get in there? And one of there's a couple of different sources that ultimately will feed that report. One of those is the custom application that we are building. And so, and it's like I said, it's custom to us. It's being built in Power, using Power, Microsoft Power Apps. And we opened this up to the staff within the Anderson Center with regards to, we have a new application coming. We wanted to help build momentum and keep that excitement around the report and its possibilities and its potential. And so I kept referring to, it's actually kind of funny because I kept referring to it as the application, and Marianne in particular was extremely dissatisfied with that. She would, ask, well, what are you calling it? I was like, well, I don't know. I don't have a name for it. So she suggested and recommended, well, why don't we ask our very talented and creative employees to name this. Let's put a competition around it, right? So ultimately, we came up with the game called Name That App, and each week it lasted for about 3 weeks. And I mean, there was a lot of advantages to doing this, and really the creativity, the engagement, making sure that the employees remained engaged and they were kept aware of the changes happening and it's coming, and having the inclusive, they felt included. I can't tell you how many people reached out to me while we were doing this competition, saying it's just so much fun. I feel like I'm contributing to this. I feel invested in it. It was a huge way to gain even further buy-in on this change that's pretty disruptive coming down the pike. So ultimately, the name that everyone landed on and chose was PACRAT. And it stands for Portfolio of Anderson Center Resource Allocation and Tracking. And the application's purpose is to manage requests that we receive for Anderson Center services, and then assign resources to the ones that we ultimately approve, and then track progression and effort that we spend ultimately on projects. So I think the name is perfect. Like, it can't be. And we had quite a few submissions. There's over 20 or close to 20. So and it's cute, like we have a cute little rodent, right? So we went quite literal with the rat part of the acronym and really ran with it in our branding. So we're fun. This is a lot of fun, and we're really, really proud of it. And people are so excited about this piece. So I'm going to give you a little sneak peek to the app itself. It is in development still. We haven't fully implemented it. We're going to be starting the launch of the Change Coalition team that Marianne shared previously. That's starting November 30th. So very, very quickly, we're going to be testing it in our test environment. But I wanted to give you a little bit of a sneak peek of what we're trying to do and how we're going to organize this work moving forward. So this is ultimately an approved project, and you'll see the project overview, the project details, what is your SMART aim, the description, all the key pieces of information that you would want to see in your project overview page. And then additionally, we have, so the interview, this is really, really nice to see back. What was that original request that came in? What was it that the partner, we call them partners, the customer, what was it that they wanted to achieve? And what this recommended here, this is going to be the services. So the specific services that through our interview process, we landed on, the deliverables. These are the things that the customer expects to receive at the end of this project. So helping us to really charter the work and hold ourselves accountable to a scope, and try to better manage that scope creep, because we have a tendency to allow that to happen quite a bit with several of our projects. Additionally, the measures, right? So all of those measures that I was showing you previously in that report, the QUIP list, this is how we assign that portfolio of metrics. And I'll get into that a little bit more in just a moment, but ultimately we can come into this page within the project, and then we can search our data catalog, our measure catalog of available metrics that we've stood up, and then assign that to that project. And that one measure can be assigned to as many projects as it is relevant. So this is super exciting too. I think that's all I have with regards to, actually, I think I did. So the reports piece, this is a way to communicate any kind of escalations or problems and the issues, the reports and the issues. This again is going to be a channel of communication to not only the project owner's manager, but also to the project sponsor. Really, once that change, that focus group has worked out what are the processes associated to using these tools, we're going to build some workflows that will send communications against the information they put in here on a monthly basis, as far as an update, a status update against the project, and how are we doing that. I don't know if it's on here. Oh, it is. So how would you rate this project's health? That health indicator that's on the page that I showed you previously, the project health page, that is where that is set. So each month to month, they can evaluate that and indicate whether or not the project's on track, or if maybe there's some things that are going wrong. All right, so that is the application. And we have a tool that it's a custom database that we developed eons ago. I mean, I don't even know. It preceded me, and I've been with the Anderson Center 8 years now. So we've used this tool, not exclusively. There's lots of data and measures that live outside of PMRS, but there are many, many measures that already do. And there's hundreds in there. Our safety portfolio of metrics, as far as hospital acquired conditions, those all live in PMRS. So there was a ton of information and measures that we already had stood up in this tool. And ultimately, measure owners, when they utilize this database, they were able to record metadata or the settings for the measures, which determines how the chart renders from the system. Previously, before Power BI, we were using SSRS for the purpose of measures that were stood up in PMRS. So what would happen is that SSRS chart would get rendered according to the metadata that was set in the directory of measures that is part of, and that directory of measures feeds information into the database that is PMRS. So once the measure is defined, another component of PMRS is the summary data capture system. And this is where measure owners and editors can submit data to PMRS, and they can also access and choose. They can do the data manually, or they can do an upload form template. It's an Excel template. They can upload the data in larger batches via that upload template. So summary data capture is a user interface to enter the data ultimately. And then there's the data visualizations that I already spoke to, which is the SSRS charts. We are actively testing and aiming to move away from SSRS, obviously, and into Power BI and the equipped list that we're standing up with the EasySPC tool, right? So we had multiple years of using this tool, tons of rich metadata that was already in there. And I just hated to not leverage and utilize that intellectual property that we already had. It had been built upon for years. And there's so much good stuff in there. I didn't want to lose all of that. And as wonderful as a tool as EasySPC is, the thought of standing up thousands of measures alternatively in Power BI gave me heartburn, and it kept me up a lot of nights thinking about like how can we use this. So we got together, James and I sat down, we talked through like, well, what could we do? How could we do this? And James Harpin, I'm going to drop his name here because he's amazing. He came up with this master SPC report, and it is taking full advantage of all the valuable metadata part of PMRS. And the directory of measures, as I said, it stores those defining variables like chart type already. We already had that information in there. So that variable, as well as measure ID, measure name, etc., those are used as parameters essentially and passed into the master SPC report. And upon clicking that link right there, it will send the user over to the master SPC chart, and it'll bring up the relevant and related chart accordingly. So super, it's like a game changer. I'm so excited. This is the piece of all of this is I'm most excited about. So once implemented, it is intended to be the one-stop shop for all SPC charts, part of quality improvement projects happening across the organization. And there is a landing page to where we'll be able to search for any PMRS measure and get to the SPC chart right away. And the end user will also have the ability to, according to what's been set in the directory of measures, and the data is loaded into PMRS, that end user can filter the chart easily by the various strata that we've set. So the division or the nursing unit or ward that you guys refer to. So right away with this report, those hundreds of measures, potentially thousands of measures with all of the different stratifications set within those measures will be readily available in this master SPC chart or report. So love you, James. All right. So lessons learned and best practices. We have, I mean, there's we're pretty early on. I mean, we've matured a lot and we've grown a lot. We've come a long ways, but we still have to do a lot of testing. So I know there's going to be a ton more lessons learned other than just this. But one thing that I would very much recommend, we did have, we didn't have time in this presentation ultimately, but there was another report that we launched, and it was phase one, the quality excellence report phase one, that we had to roll back, and it was unfortunate, but it was a good lesson learned. And the learning was confirm a commitment to that change before you launch the report. So what happened was we created the report, we vetted it with the subject matter experts, and we got their feedback. And we thought they were ready, but they weren't quite ready yet. And so ultimately they were using their old PowerPoint slide deck still after launching. And so users who received that report were confused because they thought, well, I thought we were using this new quality excellence report. Why are we using the slide deck? And there was also a couple of things with regards to our rates chart that gave them pause to not want to use that. So ultimately, lesson learned is really confirm the commitment to the change, that they're not going to go back to using the same tools that they were using previously post-launch. The other really important thing to do is establish some governance policies around all of this. And we had, like I said, we kind of opened up the tool, the PowerPoint, the Power BI template to everyone. Say, go use this and have fun and play. And we had a dev environment for them to do exactly that. But ultimately, what happened was we didn't have any kind of governance in place as far as what are those standards? What are the best practices and standards with regards to publishing and reporting? What are some security considerations? Who should have access? All of those things, like basic fundamental best practices and standards that should be in place, we hadn't done that. So it kind of turned into the wild, wild west. And then the other really important key learning that we had was prepare to receive an unbelievable amount of new requests when you start sharing these tools. People got really, really excited, like really excited, because the team was doing fantastic work. They were doing a phenomenal job, really learning the tool, and they were doing things with our data that we really have never done before. And we were sharing it, access to these reports with the premium capacity licensing. We've been able to share these in a way that we've never been able to do before, so much easier. So people were extremely excited when they were seeing the work that the very talented team of analysts and decision scientists that we have, data scientists that we have within the Anderson Center. And the influx was pretty overwhelming, and we weren't prepared quite yet for the like pumping the brakes and giving that, hey, but we're still learning right now. So just be prepared for that. All right, so best practices. These are some industry standards, and I'm not going to go into a tremendous amount of detail with each one of these, but really understanding the tools as far as Power Platform goes is important. So to get a solid understanding of how each tool within Power Platform really works with one another. That's what they're designed to do. The interoperability is phenomenal. So have a really good sound understanding that Power BI is for analytics, Power Apps is for building applications, it's for the receiving of that information, and then Power Automate is the workflows and to make it go, right? So training and adoption, provide the training for your report builders and your administrators. And then really encourage us and support a culture of always learning, and through using tools like Percipio that I mentioned earlier, that learning platform, that really helps with this. Governance and security, I already touched on, so I'm not going to get into that really. And then environment strategy, this one's really important. So plan and define the environments to separate development. So we call them stacks, right? So you want to make sure you have a development environment, a testing environment, and then a production environment. And ideally, you have that governance and security in place so that you're really utilizing and leveraging those environments accordingly and appropriately. And then naming conventions, establish a clear and consistent naming convention. It will help as your portfolio of reports really builds and grows within your workspaces, having those, and then even within your application as you're developing your applications, having standard naming conventions will really help you manage the work better. Documentation, really good documentation, keeping a record of changes that are made, and really your data dictionaries as far as your applications, which fields are intended for what is that variable. So just really incorporating really good documentation around your apps and your flows and your reports. And then testing, make sure you're doing a lot of testing. Do some thorough testing, and not only internally, but also with your end user. Make sure your end user can take a look at your applications as well as your reports, and test it, and then test it some more. All right, so where am I at here? This is now for Taryn and Oliver. I don't think I have anything further. Hope you're as excited. I'm sure you can tell I'm very excited.
Thanks, Sherry. Yeah, so just to jump in really quickly and briefly here. So as some of you will be aware already, if you're already using EasySPC and have been doing for some time now, we have a product roadmap for EasySPC, which is sort of supported by ongoing investment, and is really based on the feedback that we get from our customers in terms of new ideas and features that you'd like to see within EasySPC, and or related to your control charts and how you're using that data going forward for your organizations. So really all we wanted to touch on here is, you know, that system is there in terms of that process and that roadmap, and that we have some quite significant features coming over the coming months, which will help you with at a glance views of special cause variations across your locations and wards or directorates or sites of care. Sorry, I'm trying to use terminology for both the UK and the US there, so apologies if I've missed one or two. Things like what we're going to call there's table view, which is coming, which some of you may have heard of before. There's an early warning system, which will be further down the road too. So there is some quite innovative ideas that we're also working on in the background related to control charts and using that SPC methodology to help not only end users understand what's happening in a siloed project, for instance, but also give executive teams and leadership teams that higher level overview of what's happening at system level too. So yeah, anything that you'd like to add there, Taryn, from your side as well?
No, Oliver. Hi, everyone. I'm Taryn Sall, Director of Analytics and Automation at BCN Healthcare. So just echoing your words, really, Oliver, just to say, we're really grateful to all the 30 customers that we have around the world, and we get a lot of love from them for the product, but as ever, we want to keep pushing the boundaries and building on what we have, and not resting on our laurels. So we are taking that feedback on board, and we're looking forward to these major releases coming up in the next year that hopefully take the product from the control chart view that you have now to kind of that senior operational manager and executive level view. And I think that's an opportunity for us that will take the product to another level. Thank you.
Sure.
All right, so advance over here. I want to give you guys, Mary Ann can talk a little bit more about this as well. But we want to give you the opportunity to reach out. Like, we love hearing from people. We want to, if you have any more questions, or if you're curious about what we're doing here at Cincinnati Children's, we want you and encourage you to really reach out to us. So Mary Ann, if you want to go ahead and speak a little bit to these couple of slides.
Yeah, absolutely. So we have a couple different ways to engage with us and learn what we're up to at Cincinnati Children's. We do have a Twitter, now X handle at Cincy Kids AC, where we talk about our Anderson Center powered research, events that are upcoming, and more. We also have a newsletter called the Improvement Insider. Find out more about what we have going on a quarterly basis. And then also, maybe this is a good time to share. We took a poll last week on, I think, improvement journey and improvement culture at your organizations. And I don't know if we can flash those results, but we saw those, and we absolutely want to help folks who are trying to move along in their improvement journey, and we have opportunities for visits. And the next slide is about our quality deep dives, where folks can come visit us in Cincinnati for a day and a half agenda-filled, packed event schedule where you'd meet with executives, our operational leaders, some of our improvement professionals, where we share some of our best practices, good case studies, and you'll get to see some of our activities that we are part of on a daily basis, and how we're learning together. So we absolutely welcome you in Cincinnati so that you can get a fuller picture of what we're up to. Our next quality deep dive is in February of 24.
Excellent. As Sherry and Tara know, I've been looking for an excuse to be able to get over to Cincinnati. So this might be it. So yeah, excellent. In addition to that as well, we're going to just quickly put a poll in the chat, just for some quick feedback in regards to the series. There is also other content available out there on the web. I'll just put a quick link in the chat now to, I know there's a few from East London Foundation who are on this call too. They've got some really good content on their quality improvement site too. So if any of you are based in the UK, NHS organisations and the like, who are also interested how other NHS organisations are using control charts, etc., there's another really good piece of content there to utilise too. Just whilst we're waiting for all of your response on this poll, thank you for those who have already done that. There's been a couple of questions from Tom. Sherry, I'm not sure if you've seen the chat. I think they're more aimed at you. So if I just read the first one out, it was: do you have a dedicated testing resource, or do you peer review each other's development and user testing?
We do have, I think there's I wouldn't say that we reliably and consistently do the same type of testing and vetting with each project, with each ask and demand. We do peer reviews, and we do have a peer review process that is in place, and the degree of complexity kind of influences whether or not they do a formal peer review versus a like quick check kind of thing. We also leverage, we have subject matter experts from various, like PMRS, for example. When we're doing a change or we're building something new, we will incorporate and involve those subject matter experts and leverage them heavily in the testing process to ensure that we've really captured everything according to the way that they would expect it to. So we definitely, I wouldn't say they're dedicated, they're not dedicated, but it just depends upon the role, whether or not they get involved in the user acceptance testing piece. And then also I was I included in the chat our partners, our customers out in the organization, especially with measure development process. They are like the tester. They are the key person to validate the query that the decision scientist has ultimately, the data scientist has ultimately provided, and the output that is it what they expected it to. So they are also key people and part of the user acceptance testing. So I don't know if that answered your question, but that's.
Thank you so much. And your turns is showing the results of the previous poll, which Marianne was referring to earlier, in terms of the leadership and strategy for an organisation in regards to quality improvement. So we are at 5 o'clock on the dot, an hour on the dot. So thank you again for joining us today, and for the previous sessions. Please do share any feedback. If you've got any questions, to either ourselves or directly to the Cincinnati team, more than happy to introduce you. Mary-Ann and Sherry have already sort of agreed that they're happy for me to share their details and introduce you to them if you have any further questions or would like to get more insight into what they're achieving over there. And of course, if you do want to have a look at EasySPC and play around with EasySPC, there's a free resource out there, as I mentioned previously, and do get in contact with us if you'd like access to further features too. But yeah, thank you so much everyone for joining, and we'll catch up again next time.
Thank
Thanks all.
you.
Thank you.
Thanks, everyone.